Now, moving on to the fourth section, this will be briefly going through the diseases which involve all the multiple syndromes which also involve the nerve pathologies as well. We'll be briefly going through the arthrogryposis and muscular dystrophies, especially the Duchenne and Baker muscular dystrophy. In this section, as I told you, we are going through the arthrogryposis. It's also called as arthrogryposis multiplex congenita. Or there are actually multiple syndromes. According to some books, there may be 111 syndromes associated with this disease. So briefly, there may be multiple pathologies which actually describes different group of disorders. It's a large group of congenital disorders, all rare, in which the children are born with multiple non-progressive soft tissue contractures and associated restriction of the joint movement. There may be multiple associations as well. As I just told you, it's most commonly called as arthrogryposis multiplex congenita. It usually affects all the joints and limb deformities, and there may be contractures of multiple joints and may be associated with a lot of abnormalities as well. Usually, the fibrotic joint capsules are formed, which actually form a classical contracture, and there may be decreased movements or there may be hampered movements over the joints. Classification is actually those with the total body involvement, which is called as type 1, and other those with the predominantly hand and foot involvement. In these predominantly hand and foot involvement, there are always contractions, but mainly involving the hand and feet and associated abnormalities. And lastly called as Pterygia syndromes. This is how it is actually classified as. Clinical features, as I just told you, there could be, if you can think of any joint and pathology, probably this may be associated with arthrogryposis. Maybe include often, usually it could be featureless joint. If you see the x-rays, there may be no joint space involved. They may be completely ankylosed. Muscle may be weak, or maybe even there will be a mass reduction in the muscle mass. There may be a fibrotic contractures as well, and there may be a severe form of deformity, and patients may not be able to move their joints at all. Then shoulders may be adducted, that is due to adduction contractures of the shoulder. They may not be able to abduct properly or move their arm away from their shoulder. There is associated equinovarus deformity, in which if you see this is a classical congenital talipes equinovarus deformity associated with arthrogryposis, or maybe it may be reverse of that, that is congenital vertical talus, in which there is actually a calcaneal valgus deformity of the foot associated with arthrogryposis. There is stiff jaw or immobile tongue, as it can affect any muscle group, any joint from head to toe. So there could be any kind of symptoms associated with arthrogryposis. Now coming to the treatment. Actually, as the multiple joints are involved, therefore, and usually almost all the areas of the body is involved. It could be pelvic, girdle, it could be spine, it could be shoulder, or it could be foot deformities associated as well. So usually the treatment initially starts with the physiotherapy. Maybe sometimes splintage has to be done in case of if there is severe joint contraction. That may be helpful in relieving some of the muscle spasm and contractures over the joint. Then there may be for the popliteal contractures, especially called as orthotic devices that are used to actually stretch the knee so that the flexion contractions can be prevented. Rarely, although surgery is done, but sometimes osteotomies may be required too, so that the child can walk properly and severe angular deformities of the lower limb can be prevented. In case of if it is associated with CTEV, there may be a Pathology technique which is actually used to correct the foot from in case of CTEV. But usually in these patients with arthrogryposis, although the foot is corrected sometimes, but they are still not able to walk properly. And rarely soft tissue procedure is done, but sometimes if this CTEV associated with arthrogryposis is rigid, then soft tissue procedures may also be required as well, which constitutes main part of the surgery only. Coming to the muscular dystrophies, they are although rare diseases, but they may affect usually children as well. And in this, there's a as it is called as dystrophies, because these muscles lack a protein called as dystrophin in them, and this absence is actually resulting in muscle weakness and classical representation in form of muscular dystrophies. The most common of them is actually Duchenne muscular dystrophy. Mostly encountered is Duchenne muscular dystrophy, Other includes Becker muscular dystrophy, then is the limb girdle dystrophy, then is the fascio-scapulohumeral dystrophy, which mainly affects the scapula muscles, shoulder, and face muscles. Now coming to the Duchenne muscular dystrophy, it is one of the most common muscular dystrophies, and we will be briefly going into this. It is sex-linked inheritance is called as X-linked recessive. That means that it only affects the male children, and usually the females are the mothers of the carrier, and actually genes is transferred from the maternal father. This is two types of genes on chromosome P21 called as DMD gene, which is actually on the X chromosome, which is involved, and this results in the absence of dystrophin protein in the cell membrane, which causes increased cell membrane leakage, muscle fiber damage, and fat deposition. Clinical features, the most commonly is actually muscles are poorly developed, there is weakness, and there is pseudo hypertrophy of the muscle. Why is it called as pseudo hypertrophy? Because the muscle bulk is less, but it is actually replaced by fatty infiltration and increased fatty part of the muscle. If you see, if we observe these muscle of the calf muscles of these children, this is usually bulky, but if you touch them, they are very soft because they are mostly fat, rather than the muscle bulk is very less in them. They may be associated with lordosis of the cervical spine and hyperkyphosis of the thoracic spine as well. This is a classical kind of Gover sign because they usually affect the lower limb muscle, so they cannot use their lower limbs to lift themselves up. Rather than use the upper limbs to first stand with, so that they can first raise their hip or pelvis, and then use those upper limbs to so they can stand on their lower limbs, and usually they cannot stand without any support on their lower limbs. So the child in this sign is called as Gover sign. The child is sitting, it cannot just use its lower limbs to get off from the place where it's sitting. It actually first bends forward, uses its upper limb to first lift its pelvis, and then with use of upper limb it actually lifts by supporting on its knees and gradually stands up. This classical sign is seen as called a Gover sign, which is usually present in almost all types of these dystrophies, especially the Duchenne muscular dystrophy. Other associated findings are actually cardiopulmonary failure. They may be associated with multiple cardiac anomalies, and eventually these patients die of cardiopulmonary failure due to as their age progresses. The spine may be defective as well, associated with spinal postura scoliosis, and usually they have infantile juvenile scoliosis, which is typical of the left-sided thoracic curve and hyperkyphosis of the thoracic spine. How to diagnose them? Then there's history, then there's a classical clinical signs. The patient, usually parents come up that the patient child is there's delayed history of milestones, the patient is the child that is affected is unable to walk. Then other could be the measurements of serum creatine phosphokinase levels, which are markedly raised. Muscle biopsy with the quadriceps is actually done, and the genetic testing is done for actually dystrophin protein, and X linked on the X chromosome is actually identified for DMD gene, usually absent in case of Duchenne muscular dystrophy. The treatment is actually cannot, as there is a genetic defect, so we have to only treat the complications, not the disease itself. For if there are associated muscle contractures or muscle weakness, then physiotherapy and splintage may be an option. As you can see in this child, the use of braces and splintage devices can help them to at least carry out the activities of daily living. Although steroids may be given so that at least there's some partial remission of the disease, so that some degree of movement is restored on the joints. Gene therapy is now coming into progress, but it's not actually totally effective. Family counseling is highly necessary because there's usually associated with other abnormalities as well, such as cardiac and pulmonary abnormalities, and these usually child eventually die of cardiopulmonary failure. Then there are other rare disorders which are also associated with the muscular dystrophies, and usually they are not as common as this gene, but they can also present with similar kind of symptoms. These include uh, Baker muscular dystrophy, which is also equivalent of this gene, but the slight difference is in Duchenne muscular dystrophy. This is excellent recessive. It's kind of a milder disease, and although there's not complete absence of dystrophin, there is actually decrease in dystrophin. So the muscle is somewhat spared and somewhat affected. So therefore, overall, it has milder symptoms, and usually they live longer because the milder symptoms, they can have a lesser form of complication. And usually muscles of face are not affected at all, as in case of other dystrophies. If we get a creatine phosphokinase levels, they may be raised as well, maybe in thousands, but in case of Duchenne muscular dystrophies, there may be hundred thousands. So we have to remember that it's Baker almost mimics the Duchenne, but usually it's of a milder form. Now, other form of dystrophies include limb girdle dystrophy. It specifically affects the pelvic and shoulder girdle. That's why it's called as limb girdles, because the lower limb is attached to the body from the pelvic, and upper limb is attached to the shoulder. Usually it's autosomal recessive. There's wide leg gait, spinal muscular atrophy, and option is actually the physiotherapy and splintage is the treatment of the choice. Usually not much can be done regarding the surgical option. Very rare form of it is facioscapulohumeral dystrophy. This is a classical dystrophy which affects the facial muscle and scapulothoracic muscle, especially the shoulder girdle only. It is autosomal dominant. There is muscle weakness in the face first. There is scapular winging as serratus anterior and trapezius are involved as well, and there may be associated with scapular abduction. The difference between this and other is that this involves mainly the face muscle and the shoulder muscle, while in other deformities, usually this face and shoulder face is spared, but shoulder and pelvic girdle and limbs could always be involved. In this section, we have gone through those different dystrophies associated with neuropathy. We have gone through an X-linked recessive disease called as Duchenne muscular dystrophy, although rare, but it's a kind of a debilitating disease which affects the children, usually resulting in muscle weakness and neuropathy symptoms. We have all gone through a syndrome called arthrogryposis multiplex congenita, which is a syndrome which almost involves all the joints and associated with multiple other syndromes as well. And we have briefly gone through that usually surgical options are rarely done in these diseases, because only the surgery is only option in this cases for those areas where some kind of deformity can be corrected. But still, storing the mobility of these patients in case of arthrogryposis is very less likely, and usually the physiotherapy and splintage the mainstay of the treatment. Thank you very much. Keep watching sqadia.com.